Dr. Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. So today I want to ask a really good question I have gotten from several different patients, and that's about sexual function after a zero-depth procedure. So there can be a lot of confusion, and patients think that just because we're not creating a vagina, that she may not be able to experience orgasm or sexual pleasure after a zero-depth procedure, and that is absolutely not the case. So when we do a zero-depth procedure, sometimes called a vulvoplasty or a dimple vaginoplasty, what we're doing is we're feminizing everything on the outside. So we're creating the clitoris, the labia minora, the labia majora, and we are shortening the urethra, and we're doing everything except creating that vaginal canal. So about 15 to 20% of my patients choose to undergo that type of procedure, and they do certainly report good sexual function. So for most transgender girls, the center of their sexual pleasure is going to be the new clitoris, and of course this is made from the head of the penis. So that will certainly be the same, and we're going to preserve those nerves, and it should be functional, maybe not for a few weeks after surgery, but as one of my mentors said, if you can play the piano before surgery, you can probably play the piano after surgery. And meaning if you can have an orgasm before surgery, you're more like you're going to be able to have an orgasm after surgery. The next question is, however, about the prostate. So for some girls, the prostate tissue, which is maybe about 2 inches in, is an important part for sexual stimulation. And so most of the girls will know this before surgery. And the thing is, the prostate tissue is not going anywhere. It's remaining there. And it could be accessed through the rectum if that is important for the girl. So nothing has been taken away, none of the nerves are being interfered with there. And what's happening is, with a zero depth, we're just leaving the prostate down on top of the rectum. What we do in vaginoplasty is we separate out the prostate from the rectum, and in that space, the new vagina is created. So now, if that prostate is important for sexual function, it's probably going to be better accessed through the new vagina rather than the rectum. So the bottom line is, sexual function is very good in our patients who undergo a zero-depth procedure, and patients should be able to still orgasm, and that tissue, both the new clitoris and the prostatic tissue, if it is important to a girl, will still be intact and still usable.